This is a note for an established office patient with CHF. It contains 99 words. To figure out what it's worth, we need to determine the level of care by taking apart the history, the exam, and the medical decision-making, and plugging that information into this table, which shows the documentation requirements for established office patients. For these encounters, only 2 out of 3 key components are needed. In this case, the 1997 guidelines work out best for the physician, so those are the ones we'll use. Starting with the history, this is the table we use to determine what level of history has been recorded. First, we do have a valid chief complaint. Next, we need to figure out what level of HPI has been documented. Here we state CHF is stable on current diuretics. CAD remains quiescent with no active chest pain. Hyperlipidemia is well controlled on statin therapy. So here we have talked about the status of 3 chronic or inactive problems, which means this would qualify for an extended HPI using the 1997 E&M guidelines. Next, looking at the PFSH, we did record information about the patient's smoking history, which would qualify as an element of social history. So we have 1 out of 3 components of PFSH. Finally, looking at the ROS, here we asked about the cardiovascular and the respiratory systems, which gives us credit for 2 systems reviewed. Going back to the history table, now we know we have an extended HPI, 1 out of 3 components of PFSH, and the review of 2 systems. Since all elements are needed for any level of history, that means this adds up to a detailed history. So now the first key component is known. The next step is to check the physical exam. Looking at the physical exam and using the 1997 guidelines, we can see that not much exam has been recorded in this note. We commented on the vital signs, listened to the lungs, listened to the heart, and looked for edema, and that's it. This adds up to only 4 bullets, which means we would only qualify for a problem-focused physical exam. So now the next key component is known. The last step is to calculate the medical decision-making. Looking at the medical decision-making, and starting with the problem points, here we clearly have 3 stable problems. That means each of them is worth 1 point. So that gives us a total of 3 problem points. The next step is to check the data points. Looking at the data points, all we did here was review labs, so that gives us only 1 data point. The last step is to check the risk. Looking at the risk, it might surprise you that this encounter easily qualifies as being of moderate risk based on the presence of 2 or more stable chronic illnesses. So we definitely have a moderate risk encounter. So we have 3 problem points, 1 data point, and moderate risk, which means that since only 2 out of 3 dimensions are needed, this adds up to moderate complexity medical decision-making. So now the last key component is known. Going back to the documentation grid for established office patients, now we know we have a detailed history, only a problem-focused physical exam, and moderate complexity medical decision-making. Remember, for these encounters, only 2 out of 3 key components are needed, which means this note qualifies for the 99214 level of care. Putting it all together, remember, only 2 out of 3 key components are needed for these encounters. Here we have a qualifying detailed history, a non-qualifying problem-focused physical exam, and qualifying moderate complexity medical decision-making. So here the 99214 level of care took us just 99 words to compose and is worth $102, which works out to $1.03 per word, which is very efficient documentation. Thanks for watching Case of the Week. If you want to learn how to document your encounters this efficiently, consider signing up for one of our web-based E&M coding curriculums. We have several different options to match any practice pattern. For E&M coding education for multiple providers, let us build you a customized E&M compliance web portal, which provides centralized, trackable, and verifiable E&M coding education for multiple doctors. Thank you.